Good afternoon, my dear professor. Thank you, Dr. Ayman Fakhri, Dr. Nicole Rajab, for their kind invitation. Our topic today is about wound management in children, psychological and technological. Firstly, what is the difference between adult and pediatric wound healing? Wound management in children differs from adult in several important ways due to both physiological and psychological factors. It involves unique considerations due to difference in anatomy, healing responses, and psychological factors. The goal is to promote healing and prevent infection and minimize scarring or complication. This table summarizes the difference between children and adult in wound management according to many different aspects. According to the anatomy, there is thin. In adult, there is thick skin and slow healing rate. According to psychological considerations, the children is easily frightened, need parental support, not cooperate, but in adults, they can understand and cooperate and may tolerate procedures without sedations. Also, in pain management, there is use of age-appropriate pain scales, often require topical anesthesia, sedations. In adults, there is verbal bolting of pain. In wound healing, there is more active cell regeneration and better blood supply aid faster healing in children. In infection risk, in children, there is immune system still developing, and so in high-risk infections if not vaccinated. In wound closure, in children, there is but an adult may tolerate sutures and they may require complex closure more often. In communications and the parental role, it is essential in adult rather than in children rather than in adult. And this summarizes the difference in wound healing in adult and children. What about etiology of wounds in children? Mostly accidental due to falls, cuts, burns, bites, traffic injury, and neurological causes, post-operative, and medically related due to infections, pressure ulcers, chronic diseases, also congenital or genetic, such as Ehlers-Danlos syndrome. What is the principles of pediatric wound management? There are 10 principles of pediatric wound management. Firstly, initial assessment. Assessment is the type and depth, location, and the cause of the wound. Also, pain control, cleaning the wound, debridement, closure, dressing, infection control, tetanus prophylaxis, and follow-up and monitoring and scar management. What about the triangle of wound assessment? This triangle is practical clinical framework used to evaluate and manage wounds effectively, and it helps healthcare professionals systematically assess all aspects of wound and get appropriate treatment. It consists of 3 areas of the. What about wound bed? Our goal to create an optimal environment for tissue regeneration and the assessment of the wound bed by 3 main items: tissue type, exudate, and infection or biofilm formations. What about wound edge? Ensure the wound is progressing contractily, probably, and assessing edge type, sign of stagnations and adherence. What about peri-wound skin? Protect surrounding skin and prevent wound enlargement, assessing of color changes, temperature, integrity, by using skin protectant and manage extent to prevent macerations. What about debridement? We have recent advanced debridement management dressing, such as AquaCell hydrofiber dressing. This is composed of 2 layers of hydrofiber technology stitched together, and it helps management moderate to highly exudate wounds. Also, there is AquaCell foam dressing. It has soft absorbent foam pad and gentle silicone adhesive and waterproof bacteria barrier. Also, there is Euderm signal dressing. It is an adhesive tapered edge, modern hydrocolloid wound dressing with a change indicator. It also indicated for managing of lightly to moderately exudating wounds. How to overcome exudate in dressing? There is also negative pressure wound therapy. It is a combination of negative pressure wound therapy with hydrofiber technology with many advantages, such as easy to use, small and portable, quiet, no alarm, and is suitable for use within and across different care settings. What about odor? There is using of Carboflex odor control dressing. This is trial non-adhesive dressing indicated for shallow wounds or as second dressing over a wound filler for deep wounds. Finally, there is difference in wound etiology, assessment, management of patient and their relatives, and finally, advanced dressing are capable of facilitating wound healing, giving good patient care and achieving the best quality of life. Thank you.
Thank you very much. I think we might have the time for one question for each speaker. Um,
Dear Professor Amr,